Hi, I'm Dr. Jeremy Chow, a consultant cardiologist and director of Electrophysiology service at Asian Heart and Vascular Center. I specialize in cardiac device implantation and management as well as electrophysiology studies, including ablation. An arrhythmia is a disruption in the heart's normal electrical system, and it usually causes an abnormal or irregular heart rhythm. Anyone can actually develop arrhythmia, even a young person, without any previous heart condition. However, arrhythmias are more common in people who are above the age of 65 or who have heart injuries due to a heart attack or previous heart surgery or other conditions which will predispose them to an arrhythmia. But they can always be mistaken for conditions like heartburns, and sometimes they present with some fast heartbeat or extra heartbeat or skip heartbeats. Symptoms of arrhythmia can vary from person to person. And an arrhythmia usually lasts for minutes, but sometimes if it's very fast tachycardia, it can last for hours, and it often recurs. Most people will report an arrhythmia as an irregular heartbeat or fluttering sensation or rapid heart rhythm. And usually they may be associated with symptoms like dizzy spells, or they may even actually have a faint, and they may actually complain or feel their heartbeat or a missed beat. Very rarely do they present with weakness, tiredness, breathlessness, or chest pain. More commonly, they can actually have some very pronounced, profound thumping of the heart. There are many causes of arrhythmias, and generally supraventricular tachycardia or SVT is the most common ones. They generally can affect the quality of life of an individual who has an arrhythmia, but rarely would they predispose to sudden cardiac death, with the exception of ventricular arrhythmias. So atrial fibrillation is a form of atrial arrhythmias, which is very different from ventricular arrhythmias. Some patients who have atrial arrhythmias do not have any symptoms at all, and often they can be diagnosed when they actually go for a simple test like an ECG. And this is usually done in the primary healthcare setting, either through health screening or due to medical surveillance. So if patients do have arrhythmias, then specific tests will need to be done. And in a cardiology clinic, they will need to do things like electrocardiogram. They may need to do more than a 24-hour ECG monitoring. Sometimes we also have to run them on an exercise treadmill, and sometimes we even have to bring them to the EP lab to do an electrophysiology study to diagnose the arrhythmia. Most arrhythmias are treated with some lifestyle modification as well as with some medication. And medications can be short-term medications or long-term medications. Most common medications that we use for arrhythmias are to lower down the heartbeat. Some patients, unfortunately, will need to use medications such as the anti-arrhythmic, which is specific, and there are certain side effects that we will need to inform the patient and monitor them closely. If medications do not improve the patient's symptoms or patients are at risk for sudden cardiac death, then other procedures including ablation may be necessary. For most types of fast arrhythmias such as atrial fibrillation or supraventricular tachycardia, electrophysiology study and ablation can be curative, and the symptoms will improve and the conditions will likely not recur. But if the patients have ventricular arrhythmias, unfortunately, not all the time would they benefit from just ablation alone. They may require other interventions. For example, they may need an implantable defibrillator to prevent sudden cardiac death. For patients who actually have weak heart, we often recommend cardiac resynchronization therapy with a defibrillator to help these patients improve their heart function, improve their quality of life, and more importantly, prevent sudden cardiac death. In summary, these are the common treatments that we can offer patients who have arrhythmias, and the treatments will vary from individual to individual. Cardiac ablation is a widely used procedure that is proven to be safe, effective, and long-lasting treatment for many types of arrhythmias. During a cardiac ablation procedure, long catheters are inserted through a blood vessel into your heart. Your doctor or nurse will numb the site where the catheters are inserted into your veins, and this is typically done on one or both sides of your groin, or sometimes the neck, in order to gain access to the heart. You will most likely not feel the catheters as they are being guided into the heart because there are no nerve endings in the veins. Hence, the procedure should not be painful. An X-ray allows your doctor to see the catheters as they are advanced into the heart, and these catheters are then used to locate and ablate the specific target cells in the heart that causes the arrhythmia. In other patients with arrhythmia, implantation of a cardiac device might also be considered. These cardiac devices are categorized by their functions, and they include the basic pacemakers to the more complex defibrillators and cardiac resynchronization therapy devices. Your doctor will recommend a suitable cardiac device for you based on your medical condition. During a cardiac device implantation procedure, long thin wires called leads are inserted through the blood vessel into your heart. Your doctor or nurse will again numb the site where the leads are going to be inserted into your veins, and this is again typically done on the upper chest just below the left collarbone. An X-ray is often used by your doctor to see the placement of the leads as they are advanced into the heart. You will most likely not feel the leads as they are being guided into the heart because there are no nerve endings in the veins. After the leads are fixated in the heart chambers, they are then connected to the pulse generator, which is the cardiac device, which will be placed underneath the surface of the skin and underneath the subcutaneous tissue. Recovery from cardiac ablation is quick. Many patients are able to return to their normal activities within a week after the procedure, including exercise and running. For patients who have a cardiac device inserted, post-implant recovery varies according to each patient's condition. Most patients will recover within a week. But if you are going to do specific activities, please discuss with your doctors before resuming your routine day-to-day activities.